4,821 confirmed cases and 670 fatalities. As we've said all along, we continue to base the decisions that we're making on the data, and after 3 weeks of modified phase 1 restrictions, we are now able to move forward into a modified phase 2. That's going to be very similar to the state's phase 2 with a couple of key distinctions, and we'll walk you through those today. We are going to be moving to 50% capacity across the board for restaurants and businesses. Outside. These restrictions will remain in place for 3 weeks through Mardi Gras. Bars will remain closed throughout this phase and through Mardi Gras, regardless of where we are in the positivity rates. When we announced our return to modified phase 1 3 weeks ago, we had a positivity rate of 10.4%. As of yesterday, our rate was at 5.9, and now it's a little below 5 at this point. To be clear, this isn't where we need to be yet, but we are definitely heading in the right direction. There's a very clear cause and effect, and I want everybody to be very clear on that. When we change our behavior, when we see the numbers go up, we make an adjustment and the numbers go back down. That's not abstract. Those are lives that are being saved. So the difficult decisions that we've made, the sacrifices that residents and businesses have been called on to make, have saved lives. They've made a difference. And I think that's very much reflected in the data and the numbers. It's not the time to let our guard down, and we certainly need to remain vigilant throughout carnival season and beyond. There is, as I think everyone is aware, a new variant of COVID-19 that is more contagious, that has been detected in Louisiana, so we can't let up and we can't let our guard down. The things that helped us flatten the curve this time, the last time, and before that will continue to work going forward. They continue to be the best practices. Wear your mask, practice social distancing, avoid large gatherings, and wash your hands. We're all very proud and very grateful to our residents and to our businesses for all the work and the sacrifice that they've made to get us this far, and we're confident that as we step forward, as we move forward, that everyone's going to continue to do their part, and we're very grateful for that. I'll now turn it over to Dr. Avegno, and then I'll be back up for some questions.
Thanks, Bo. Good morning, everybody. I'm going to flesh out, a lot of what Bo said, and I'm happy to answer questions as well. Once again, as he noted, we've seen a clear relationship between the spread of COVID-19 and the individual actions and really the community-wide actions we're all taking on a daily basis. By seriously restricting interactions between people in New Orleans over the last 3 weeks, we've seen an improvement in all of the metrics that we watch every day. Cases are falling, but they're still higher than we want them to be. Hospitalizations are slowly improving, both in New Orleans and statewide, but make no mistake, our hospitals are still stretched. The rate of positive tests is under 5% for the first time since early December. These improvements are really promising and have gotten us to where we are today, but I need to stress that we are nowhere near out of the woods. And we're likely still seeing the impacts of our surge 3 weeks ago in the number of deaths reported in January. There have been 34 deaths to date in January. That's fairly high for a month, and it does reflect the fact that deaths generally lag 2 to 3 weeks after the peak of an infection. So the small strides we've made will allow us to inch back towards normalcy, which is why we're here announcing the modified phase 2. And again, just to reiterate what that means in changes from where we are currently. Most sectors will be allowed to resume to 50% capacity. So that's retail, that's restaurants, that's office buildings, that's churches. Everything that was at 25% by and large goes to 50%. Again, this doesn't include bars. They still could not open under state regulations anyway, indoors. Social gatherings will be limited to 10 indoors and 25 outdoors, with masks and social distancing still required at all times. Again, we're making these changes because these sectors, our business community, have again proven that by and large they can conduct business safely when they follow the guidelines. And social gatherings continue to be our main source of spread. I really want to clarify what we mean by social gatherings because I think there might be a little confusion. These include social events like a wedding, a party, a backyard barbecue, a second line, an event at an event space. These are all examples of what a social gathering is in. In these settings, People are mingling, mixing with each other. They're not generally seated for the entire duration. They are close to each other, not distant. They are often in the situation where they're taking off their masks, whether it's eating and drinking or whether it's to socialize, rather than masked. That's very, very different from what we think of even when we go to a restaurant and you're seated at the same place for a long amount of time, only taking that mask off to eat or drink, or an office building, or a classroom. Very, very different. These situations are considered high risk, even potential super spreaders, because the number of people coming into close contact with each other. That's why these gatherings remain limited, and we've put numbers on them, to 10 individuals indoors and 25 outdoors. Even this is a relaxation of where we just were, where it was not allowed to mix with anyone outside your immediate household. So this is a little bit of a relaxation, but because we know this is where the majority of spread is happening, it does not warrant going back up to large sizes. Again, the setting of an office space, a classroom, or a church service is not the same as a social gathering because people are seated, they are apart from each other, they do not get up and mix and mingle and walk around, and they're masked the entire time. At least they are if they're sticking to the guidelines, which they should be. So these activities are going back up to 50% capacity and do not have the same limits as social gatherings. The distinction here is in line from what we've heard for months from our State Department of Health contact tracing and other data about how the virus is being spread, as well as what we're hearing from communities all over the country. New Orleans, this is not any different than what we hear of the way the virus is spreading elsewhere. So although we're happy to be able to ease some restrictions, I don't want anybody to take away the wrong message. We are very much engaged in what may be the worst COVID surge to date. Certainly it is nationwide. Fortunately in New Orleans, it's not quite where we were last March. But there are a lot of unknowns in our future. The progress we've made in the last few weeks is very tenuous and could change with a single person carrying one of the variants. And I say variants because there's really more than one right now that are concerning to public health experts. There's the UK, which we'll talk about in a second. There's a South African variant, and there's a Brazilian variant, and 2 out of these 3 have been found in the US. What they seem to have in common is that they appear to be more contagious. We don't know exactly how much more contagious. There's been numbers ranging from 10% to 50% more contagious. Just by the fact that they're more contagious, that means they can cause more cases, more hospitalizations, and more deaths. Public health experts, the CDC on down, expect 1 or more of these, probably the UK variant, to be the dominant strain in the United States by March. So I want to just give you the example of the UK, of Great Britain. They have struggled with coronavirus very much like the US has. They were getting to a point last winter where, or just a month or so ago, where they were starting to ease their lockdown. People were going to pubs. They were having dining again. And then this variant completely overtook all of the other strains of virus. And now if you're following what's happening over there, they are back into full lockdown with their hospitals overwhelmed and their death rates surging. So that is how quickly things can change with one of these new variants. There is a lot we don't know about these. I do know that we are searching for them aggressively. I think you know that one of the a case of the UK variant was identified in this region a few weeks ago. So far, we have not had any more, but we're really ramping up our surveillance because, unfortunately, it may be only a matter of time. So with gatherings, a clear source of spread, with the concerns about the new variants on the horizon, we're asking everyone to be especially careful these next few weeks. Parades and second lines and other events we'd normally be having obviously cannot happen this year. It has really been incredible, personally, to watch all the creativity that has happened creating the crew of house floats and all of the house decorations. This is an amazing way to adapt our traditions, to stay safe, and to keep people employed. And I really think it's the envy of a lot of cities. Please observe carefully. don't be in a big crowd. I've been really pleasantly surprised to see people just walking with their families, taking pictures, wearing masks, being socially distant, enjoying what they see, but doing it in a safe way. We know now that last Mardi Gras likely contributed to the early and rapid spread of COVID and claimed the lives of many. So we just can't let that happen again. I'm going to close with an update on vaccines. I'm in contact with local, regional, state, federal health officials every day, and everyone is facing the same challenge, and that is supply. It's supply, supply, supply before anything else. We do not have adequate supply to vaccinate our current priority group, which includes our frontline healthcare workers, nursing home facilities, dialysis home health, and our 70+ seniors. However, we're very encouraged locally. All of our healthcare providers who do have vaccine are squeezing every single dose out of every single vial. There has not been a drop wasted. They are actively going out and reaching our 70+ population in general to try to get them scheduled. I'm really excited to see the number of our seniors who are taking advantage of this. We were nervous that there would be some hesitance, but I think this is a group that has suffered the most, and they know exactly what's at stake, and they are eager and willing to roll up their sleeves. We're working closely with our team in neighborhood engagement to speak with communities around the city about the vaccine, to answer questions, to do outreach, to hopefully convince people when it's their turn. We've done dozens of these events. We have many, many more to do. And that's been really great to see the participation and just the interest from the community. You've probably seen our Sleeves Up NOLA public service announcement, our fantastic campaign that is the envy of every city, and was in the New York Times and on the BBC this week, just showcasing our local culture bearers, what the vaccine means to them, and encouraging everybody to do what they need to do to feel confident to take it. So I hope everybody's getting the message that the vaccine is our way out. But right now is really a cause for patience and continuing to keep each other safe, because the vaccine is only going to work for people who are alive to take it. So I'll stop there, and I'm happy to tag team with Bo on any questions.
Dr. Abegno, given these new strains out there, the last 2 nights on national TV, I've seen people recommending people wear double masks. Is it too early to do that here yet, or do you think it might not be a bad idea?
It's really not a bad idea. Yeah, 2 masks are the 1 mask, is what I saw. It's not a bad idea. There are different... Every mask has different levels of protection. Obviously, we all know N95s are the highest level of protection from the virus, but we're not quite out of the woods in terms of PPE, and we really should reserve those for our healthcare workers. Surgical masks also provide good capability, but again, they're not as easy to get. There is nothing wrong with doubling up. There is a limit though, right? 5 masks don't make you safer than 2 masks. And that's because the more masks you put on, the heavier it is, the more you'll have a tendency to try to blow outside of your mask, and that kind of defeats the purpose. So if you want to use 2, that might, the thinking is it might provide some extra benefit, but that doesn't mean you can get closer to somebody, right? If you're using 2, you have to stay the same distance away and still not gather and still do all the other things for them to be effective.
Oh, yeah. Dr. Abegno, you mentioned second lines a couple of times, and obviously yesterday we had a couple of big ones. Saying goodbye to the trombone player Treme, and then there was another one over there as well. I imagine the challenge of trying to get folks to continue to understand that and what our culture is and all. How does the city intend to attack that going forward?
Yeah, and I'll let Bo speak to that enforcement specifically. We've done a lot of outreach. We've communicated across the board, whether it's second lines or whether it's folks throwing big parties in establishments that are clearly against the guidelines. We can't.
On social media, the Endymion weekend, people intending to still have their spreads, if you will. It's like
that is putting our community at risk, just like last Mardi Gras did. And so I have a hard time believing that anyone would knowingly want to cause the death of someone else, even if they don't know them. Bo, do you want to talk to enforcement?
Yeah, no, I'll just echo what Dr. Avegno said, that any large gathering, particularly, of that scale, is potentially a super spreader event that puts people's lives at risk. As I said from the podium yesterday, the Mardi Gras crews are largely meant to be public service organizations, right? In addition to the parades every year, they perform public service. Any event or super spreader event that spreads the virus, that creates disease, does a disservice to the public health. And we strongly discourage that. As a matter of fact, it's not permitted under the guidelines. So that's where we are on that.
WWL followed by the attitude.
It's probably more for Bo. There's been a lot of talk today about carnival season, and coming weeks would be the big time. I mean, should people be coming here right now?
We know that they will be, right? I mean, that's kind of the reality of the situation. It's Mardi Gras, and as we said at the very beginning of this, Mardi Gras is a day, it's a religious holiday, among other things. It's not something we can cancel. The parades are not going to be allowed. The large gatherings are not going to be allowed. But knowing that people will be coming here regardless, we are being very clear that the rules apply to visitors and tourists and everybody else, just like they do to our residents and businesses. The people and the businesses of New Orleans have worked very hard over the last 10 months to get this under control. Most recently, in the last 3 weeks, we went into enhanced restrictions, which we're now able to lift today because of that hard work. We would ask and really insist that all of our visitors that are coming obey those same guidelines, respect the work that's been done, respect the lives that have been lost, and follow the guidelines.
But if there are messages over the city saying, don't come right now, because in theory, there's no reason to. There's not much happening in terms of Mardi Gras celebration.
Again, I can really just speak to what the expectations are, right? That everyone follow the guidelines that are in place.
The attitude.
I was wondering if you guys could speak to the threshold. I know that we haven't been at 50 cases a day in quite some time, and I was wondering, like, what is the new threshold that y'all are looking at to be able to allow for decreases in restrictions?
Yeah, that's a great question. The 50 a day we set, gosh, I can't even remember how long ago now, maybe June. And it was based on our testing levels at the time, which were still high, but probably, less than half of what we're doing now. And there are a lot of factors for that. And as we've learned more, and just sort of looking around the country, there isn't a real hard and fast. There are some guideposts. We're close to the threshold below which, some of the big data and public health groups would call sort of the medium risk. We're in a high, the number of cases alone right now puts us in a high risk category. The entire country is in a high risk category. There's very few counties or parishes that are, safer. We're trending towards being safer, which is good. But we've really gotten away from using that as our sole metric. A couple of reasons. One of the main reasons is because back when we sort of set this threshold, the vast majority of testing that was being done was on symptomatic people. Now we're testing asymptomatic people. So you have more cases identified, which is always good because if you're asymptomatic and walking around with COVID, you want to know so you can quarantine, but it increases the number of cases. Make no mistake, our cases are still very high. I would love to get us back down to that 50 per day level, which is about an incidence of 10, 12 per 100,000. That is a much safer place to be, and that would be reflected in our other metrics as well. There's a balance though, right? We have found that can we open more sectors safely at a higher rate of cases as long as we've preserved hospital capacity and our deaths, do not skyrocket as they were, and is that on balance a little bit better? Again, as we get more and more people vaccinated, that helps as well. So I would love, I know everybody kind of wants a cutoff, and I'm kind of a data nerd, so I do too. But what we've learned is that being flexible and looking at those numbers in the context of testing percent positivity, hospitalization, the rate of transmission, and not just sort of fixating on one number seems to be a reasonable approach.
And can you also just share with us some of the rationale for keeping bars or indoor service closed through Mardi Gras as opposed to following the state's guidance?
Well, right now we couldn't open them anyway, right? We still don't have the numbers to open them anyway. So it's likely that they would be as well. And again, you know, it's still, unfortunately, indoor services at bars has proven to be very risky. Just to, you know, there are things you can do to mitigate, and they're being done in the outdoor setting. So seating, table service, no bar seating, right? All of that makes them more like a restaurant, more like something that that is not an uncontrolled gathering. I think you've seen some pretty high profile examples though of what happens, you know, when indoor events that were not permitted occur in those kind of spaces. There's just a lot of concern for those being a spreader.
And I'll follow up on that real quick. Indoor bar seating drives cases, it drives infections, it becomes a super spreader event, potentially, right? The guidelines that are in place at the state level, that 5% threshold, is an excellent touchstone, but we have to, as Dr. Vegna said, look at the larger picture and look at all the potential metrics. As I think Danny mentioned a second ago, we know people are going to come, but there's nothing to come for Mardi Gras. And the bars not being open is a part of that, right? Bars can still serve outside as they have been. I want to be clear about that. We're not changing that. But indoor bar seating is simply not safe at this time. And regardless of what the variation is on that between 4 to 6% where it is in there, we don't believe it's going to be safe to reopen those through the Mardi Gras season, particularly because of the anticipated, you know, additional potential bandwidth strains. So that's that piece.
Councilor Diaz,
So just to make sure, if the city did fall under the 5% positivity rate, I believe, is it
2 weeks in a row.
It would have to be sustained for 2 weeks, which we've not hit
We're
yet.
not even.
Right. So that said, you know, these guidelines that are announced today, including the bars being closed to indoor service, will remain in place for 3 weeks, regardless.
What is the positivity rate currently?
It was 5.9 yesterday, and
My understanding, it should be coming out any second now. They release on Wednesdays. My understanding is it will be below 5% today officially from the state.
So even if we are,
even if we're below today, which we anticipate, but we don't have the number yet, and below next week, we are still keeping bars closed to indoor service in Orleans Parish for the next 3 weeks.
any plans to issue, for people that just don't abide by the guidelines, are there any plans to strengthen the repercussions, citations, or
Sure.
anything of that?
Yeah, I mean, as I think you've heard me say, and the mayor say frequently, our preference is always going to be for, you know, compliance, willing compliance on the front end from vendors and from business owners. We expect and frankly deserve to have our businesses and business owners working alongside of us, right? This is not an us versus them thing. This is everybody working together so that next year Mardi Gras is what we all want it to be, right? So that we can get back there. In order for that to happen, we do largely, Winston and his team that are out there doing the code enforcement, they work first and foremost to get verbal compliance, right? They come out, they give a verbal warning, they explain what needs to happen differently, and by and large, we are seeing compliance there. That said, where we do see bad actors, where we see people that are willfully flouting the guidelines, that are maybe refusing to comply, yes, you will see enhanced enforcement action. What that looks like will be determined ultimately on a case-by-case basis. Our ask right now is that residents, visitors, and businesses really respect this guideline. We know what happened last spring, right? Like we had Mardi Gras and didn't know. We were not aware of the level of the danger that was involved. This year we know. We're going into it eyes wide open, and we need everybody to act accordingly.
So, given, as you said, people are going to come to New Orleans for Mardi Gras anyway, I gather they'll be able to buy takeout drinks on Bourbon Street and walk the street. How concerned are you about huge crowds on Bourbon Street, and has any thought been given to setting block size crowd?
Sure. Yeah, I know. My understanding is that those operations plans for Fat Tuesday are still in the process of being worked through. Certainly, the core concern there would be large gatherings. That's been a huge issue throughout this pandemic, throughout 10 months. And that's something that we're, as I said, we're going into it eyes wide open. It's something we're aware of. And as we move closer to that day, and certainly on the day of, I anticipate you'll see, you know, additional changes that would be made in response.
And Dr. Vegno, how difficult was it for you to ease these restrictions at a time when the new variants are starting to show up in the United States? And do you have any feel for when we might see those in Louisiana? Is anybody projecting that at this point?
Yeah, I mean, it is difficult, but we have to move on the data that we have. I think we owe that. I think we've done that the last 10 months. I think, you know, we know that there has been a case of the variant, the UK variant here. Most public health experts are projecting March for if it's going to take hold, it will have taken hold by then. So that gives us about, 6 weeks or so. I don't want to see another surge in March. But again, the key thing is the same things we're doing right now protect against this variant. This is not some sort of variant that burrows its way into your mask, right? Or that jumps on you from 20 feet away. So if we can just continue what we're doing, new variant or not, we will be protected. The problem is if we let our guard down, it becomes much worse than it already is. And it's already, we saw what happened over the holidays. We saw what happened when, people let their guard down and went to holiday and family parties and how quickly it spread. So just, multiply that by a factor of contagiousness, and we'll be back to where we are. It's a race against time, honestly. It's a race to get our seniors, our most vulnerable, and those on the front line vaccinated before this virus can take hold. That would be the ideal. We're ready to do it. We need supply. We are getting great, we have great communication with the administration, and we know they want to increase supply. But it would be a really tragic thing if a 75-year-old died in March from this new variant when we could have prevented it and we, could have theoretically gotten them a vaccine. So.
One or two more questions. Gambit.
Outside of the Crew of Red Beans initiative with the city and Present Care, is there any extra outreach being conducted toward seniors and vulnerable people who don't have access to the internet or understand how to make appointments online?
Yes, this is a great question, and this is what certainly at the health department and our partners at NOLA Ready we have been consumed with for months, is how to make sure that this vaccine rollout is equitable. We know that a lot of seniors have challenges with internet and technology. We know a lot of them have mobility challenges, access challenges, and so we've been planning for that since day one. We have a lot of the outreach we've done. This morning I was just on Senior TV, is reaching out to seniors, telling them how they can get their vaccine, encouraging their younger family members to help sign grandma up for the vaccine. We've been reaching out at churches to have those trusted community leaders and just other community partners getting the word out. We've been working with all of our healthcare providers that are giving vaccine to say, okay, do you have slots? Here are some lists, here are some folks from this particular area. We have a special needs registry that was developed for our hurricane planning. And we have started calling everybody 70 plus, figuring out how can we get them connected if they're not already connected. The good news is that a good amount of them are connected, which is exciting. What we're also doing is setting up through 311 a citywide wait list for those eligible for the vaccine right now. So right now that's our 70 plus. So if you are 70 plus and you don't have a connection to a clinic, a hospital, a pharmacy to get your vaccine, you can call, we can take your information and put you on a list that then providers will be able to see. So when they have extra doses, when they, if they get an extra 100 or 200 from the state for whatever reason, they can not only dip into their waiting list, but our waiting list as well. We are very, very hopeful and in pretty detailed planning stages that when supply increases, we will have mass vaccination sites. So working with our transportation partners to be able to shuttle people back and forth. We're also working on a pilot for delivering vaccine to homebound seniors who have no other way of getting it. So we are trying to reach every single corner, every single person, because this is not going to work if the only people that get this vaccine are those who have access to technology, a car, and all sorts of resources, and we leave others behind.
Just quickly, we've spoken about bars and restaurants. Are there any significant changes for places like salons or barbers or?
Yeah, all that goes back to 50%. Everything that was at 25% goes back at 50%. And we'll have graphics out if they're not all right out. As you know, everything's going to be on the website, so you can easily access it.
Last question, WWL.
Oh, and this goes into effect Friday or when?
Oh, yes, Friday morning, 6 a.m. or 8 a.m. I can't remember, 6 or 8 a.m.
Yeah, Friday morning.
Friday morning.
So as Dr. Wagner just said, all these graphics are going to be available on our social media channels momentarily if they're not rolling out right now. The full website will be updated by the end of the day today. We're having a little bit of a lag on that, so we'd ask people to just check the site towards the end of the day for a full review of the details.
And
Okay?
just real quick, we just got the number, the positivity number for Orleans is 4%. Can I get your reaction to it being that low? When was the last time we saw it?
It's been a minute, right? I'd have to look back on my spreadsheet, but probably not since November. To go from 10.9 to 4 is a big deal. I will say, and I want to be honest, we do now have our universities testing again, and they always contribute, when they do test, they contribute a significant number of tests into the pipeline, but they were testing in part of December and our rate was not this low. It's not just the universities. It is, it's robust testing everywhere and cases dropping. So that's exciting, and it means that what we're doing is working.
Thank you all.
Thank you.
Thanks a lot, everybody. I promise to wear a tie next time.